Velsipity 2 mg tablet is used to treat a bowel disease called ulcerative colitis. It helps to decrease symptoms such as diarrhea, rectal bleeding, and stomach pain. The recommended daily dosage is 2 mg, and it is important to take the tablet at the same time every day. Before you start taking Velsipity 2 mg tablet Sphingosine 1-Phos Recep mod for multiple sclerosis / Inflam.Bowel, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Remember to swallow the tablet whole. Using this medication regularly will help you get the most benefit from it. To help you remember, take it at the same time each day. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of side effects will increase. If your condition does not get better or if it gets worse, make sure to tell your doctor. Some common side effects of Velsipity 2 mg tablet Sphingosine 1-Phos Recep mod for multiple sclerosis / Inflam.Bowel include headache, dizziness, and lightheadedness. To minimize these effects, it's important to get up slowly when moving from a sitting or lying position. This medication may also raise your blood pressure, so it's important to monitor it regularly. In some cases, etrasimod can cause liver disease, so be sure to contact your doctor if you experience symptoms such as nausea, loss of appetite, or yellowing of the eyes and skin. Additionally, this medication may lower your ability to fight infections, so it's essential to be aware of any signs of infection and seek medical attention if necessary. It's important to note that Velsipity 2 mg tablet Sphingosine 1-Phos Recep mod for multiple sclerosis / Inflam.Bowel may also increase your risk of a rare but serious brain infection called progressive multifocal leukoencephalopathy, PML. If you experience symptoms such as clumsiness, weakness, or difficulty speaking, seek medical help immediately. In the case of very serious side effects such as shortness of breath, severe dizziness, or a severe allergic reaction, it's crucial to seek medical help right away. If you experience any side effects not listed here, contact your doctor or pharmacist. Before using Velsipity 2 mg tablet Sphingosine 1-Phos Recep mod for multiple sclerosis / Inflam.Bowel, make sure to inform your doctor about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions. It's important to also inform your doctor about your medical history, especially if you have any breathing problems, infections, diabetes, eye problems, heart problems, high blood pressure, liver problems, skin cancer, stroke, or if you have a history of fainting. When taking this medication, be cautious as it may make you dizzy. Avoid alcohol or marijuana, and do not drive or use machinery until you can do so safely. Etrasimod can also increase your risk of getting infections or make current infections worse, so it's important to stay away from anyone who has a contagious infection. You should also discuss your vaccine history with your doctor and ask if you need any vaccinations before starting treatment. Be mindful of the sun when taking this medication, as it may increase your risk of skin cancer. Use sunscreen and protective clothing when outdoors, and limit your time in the sun. Before undergoing any surgery, inform your doctor about all the medications and products you are using. If you are pregnant or planning to become pregnant, discuss reliable forms of birth control with your doctor, as this medication may harm an unborn baby. It is not known if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Velsipity 2 mg tablet Sphingosine 1-Phos Recep mod for multiple sclerosis / Inflam.Bowel, as they can affect how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with this drug include other drugs that weaken the immune system or increase the risk of infection, as well as fluconazole and rifampin. Always consult your doctor before starting, stopping, or changing the dosage of any medications. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the United States, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share Velsipity 2 mg tablet Sphingosine 1-Phos Recep mod for multiple sclerosis/Inflam.Bowel with others. Before starting this medication and during the course of treatment, your doctor may conduct various lab and medical tests such as complete blood count, blood pressure, pulse, EKG, eye/skin exams, liver function tests, and lung/breathing tests. It's crucial to attend all medical and lab appointments as scheduled. For more details, consult your doctor. As for the optimal timing and daily dosage, it's best to follow your doctor's instructions. They will provide you with the specific details and recommendations tailored to your individual needs. If you happen to miss a dose of Velsipity 2 mg tablet Sphingosine 1-Phos Recep mod for multiple sclerosis/Inflam.Bowel, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. It's important to stick to your regular dosing schedule. It's important to store Velsipity 2 mg tablet Sphingosine 1-Phos Recep mod for multiple sclerosis/Inflam.Bowel at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it's expired or no longer needed, be sure to properly discard the product by consulting your pharmacist or local waste disposal company. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.